Hey everyone, it's Dr. Alexis, and today I wanted to talk to you about the types of testing you should be asking your doctor for, and why some forms of tests are better than others. Let's start by talking about testing for estrogen. There are three types of estrogen: estrone, estradiol, and estriol. Estrone and estriol are weaker forms of estrogen. Estrone is found highest in pregnant women. It's also found in high levels in vaginal tissues and is also protective for your brain and your bones. And estriol is found in the adipose or fat tissue of menopausal women. Estradiol is what strengthens your hair, your skin, and your nails, and it can be protective against cancer and is also known to be supportive of your cardiovascular and your bone health. It also regulates vasomotor symptoms, which are known as hot flashes, something that women experience as early as perimenopause. Estrogen has a very unique relationship with serotonin. So when there are changes or fluctuations in hormone levels, it can leave women susceptible and vulnerable to having mood swings or even being diagnosed with a mood disorder. Estrogen has an important role in your menstrual cycle. The main role is to build up the endometrial lining in your uterus, which is important for implantation of an egg, and that lining is what is shed during your menses. In the first half of your cycle, in the follicular phase, estrogen is at its lowest. And then 2 to 3 days before you ovulate, it has a huge spike. It then drops again in the second half in the luteal phase, and then has a small increase and then drops again in preparation for the next cycle. When it comes to testing for estrogen, it's not only important to know the levels of the three types of estrogen, estrone, estradiol, and estriol, but also how your body metabolizes and clears those estrogens. Your body uses three pathways to metabolize estrogen in your body: the 16-OH, the 2-OH, and the 4-OH pathway. I will go into much deeper detail in another video in the future, but what's important to know now is that 2-OH is the only pathway that is protective, while the other two can increase your risk for breast, uterine, or ovarian cancer. Now, to find all this information out, I use the Dutch test. The Dutch test is a comprehensive hormone panel that I use on my patients to see not only their hormone levels, but also the estrogen metabolism, as I just discussed, and estrogen clearance. Clearance is important when it comes to estrogen, and during clearance, a process called methylation occurs. During methylation, a methyl group is attached to the estrogen so that it can be excreted from the body. Now, if that methylation process is weak or not supported, then those estrogens or bad estrogens recirculate back in the body, leading to estrogen dominance. Now, testing your estrogen levels through blood will give you accurate information, but it won't tell you how your body's using those estrogens. Now, let's talk about progesterone. Progesterone's role is to aid in successful implantation of the egg once the egg is fertilized, and it is also known as a calming hormone. It helps you relax, reduces anxiety, and helps you sleep at night. Many studies indicate that blood testing of progesterone don't adequately measure the actual levels of progesterone in your body, and there have been many inconsistencies with saliva testing. The Dutch test measures progesterone metabolites and then gives a very close estimate of the actual levels in your body. These are the results that I rely on when measuring progesterone in my patients. I also want to add that the best days to test estrogen and progesterone is on day 21 of your menstrual cycle. Now let's talk about your male hormones, also known as androgens. It's important to know the levels of androgens in your body, such as free and total testosterone, DHEAS, or DHT, also known as dihydrotestosterone. These are important for overall motivation, energy, and sex drive. Now, all of the hormones that I just mentioned can be tested through blood, but I like to use the Dutch test, especially when dealing with patients that have androgenic symptoms like acne or male pattern baldness, or patients with polycystic ovarian syndrome. The Dutch test shows metabolites of another androgen called androstenedione, and the breakdown of that hormone could lead my patient down in more androgenic pathway or non-androgenic pathway, which allows me for proper assessment of the cause of those androgenic symptoms. As always, I recommend getting a thyroid panel done as well, and that could be done through a simple blood test. Symptoms of thyroid imbalance often mimic symptoms of hormone imbalance. Adrenal function testing is also important, as there is constant communication between the HPA and the HPO axis. You can have your adrenals tested through saliva or urine. If you have any questions or experience with hormone testing, especially using the Dutch test, drop it in the comments below. Hit the like button, subscribe, and I'll see you on the next one.